Hello, everyone, and welcome to the Toronto Metropolitan University's School of Medicine's Fireside Chat. Thank you for joining us today. I'd like to start off with a land acknowledgement. Brampton and its surrounding areas, Peel region, is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land and continue to do so today. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. Hi there, everyone. My name is Usha Srinivasan. I'll be your host for the next 45 minutes. I am the director of Brampton Venture Zone by TMU. We are a non-equity incubator launching early stage technology startups right here in Brampton. We are funded by the city and we are focused on 5 industry sectors: health and wellness, smart city mobility logistics, advanced manufacturing, food sustainability, and film, music, and entertainment. I'm certainly passionate about our community here in Brampton, and I couldn't be happier to support TMU's plans to open this brand new medical school in 2025. And of course, accompanying me today are Dr. Mohamed Lachemi, President and Vice-Chancellor of TMU. Welcome, sir. And Roberta Iannacito-Provenzano, our newly appointed Provost and Vice-President of Academic. Welcome to both of you, and really looking forward to this conversation today. We're excited to spend this time with you to share information and answer your questions about the school. We'll speak to 8 questions today that were submitted in advance by members of the Brampton community and others. To keep us on course, please note that the chat function will not be open during the presentation. If after today's discussion, you have additional questions, we encourage you to reach out to us through the contact page on the School of Medicine website. That is very important for us to hear from you, so please do send us additional questions if it comes through the discussion here today. Now I'll hand things over to Dr. Lachemi, Mohamed, who will give a few introductory remarks. After that, we'll hear from Roberta, and then we'll launch with the questions. Over to you, Dr. Lachemi.
Thank you very much, Usha, and hello, everyone. I'm so pleased that so many of you were able to join us this afternoon. More than 2 years ago, TMU began its journey to establish a School of Medicine in Brampton. Since then, community engagement has been essential, as it will continue to be well beyond when the school opens its doors in 2025. Yes, it's 2025, 2 years from now. Throughout 2021 and 2022, TMU hosted 11 town halls, collaborated on 14 engagement and consultation sessions, and gathered input through an online survey. To date, we have had more than 20,000 touch points with the community to ensure your voices are integrated into every step of planning for our medical school. That includes more than 70 or more than 700 physician touch points. We are building this school with the communities it will serve. And that is a very important message from us. TMU selected Brampton as the location for the School of Medicine because the community is diverse, resilient, innovative, and a microcosm of what communities will look like across Canada. What do we do in Brampton? We'll set the standards for inclusive and innovative medical education and healthcare transformation. Brampton and area residents, community agencies, and health partners have provided unwavering support in project approvals, planning, and development. And our planning team is regularly in consultation with the Provost and the Ministry of Health. It is this level of deep, action-oriented commitment that will address the changing needs for healthcare delivery and practice in Brampton and surrounding areas. The School of Medicine will not only build on the university's excellence in health and current health partnerships, but also in its relationship with the city of Brampton. Brampton and TMU have a history of successful partnership with projects like the Rogers Cyber Secure Catalyst and the Venture Zone in Brampton, led by Usha, both of which provide a strong foundation for future collaboration. As part of the comprehensive plan to increase medical care in Brampton, the university would build medical service capacity by creating family care clinics. Later on in this session, I'm sure we'll talk about our approach, a new approach called integrated health clinics. Clinic onboarding of 5 to 10 physicians or family-focused medical practitioners would connect up to 50,000 patients with access to primary care physicians and related medical services. This model will serve as a clinical training ground for new doctors and eventually for students attending the TMU Medical School. TMU is also thrilled to work with the William Osler Health System as its primary clinical partner for the School of Medicine. Osler will support the School of Medicine by providing clinical learning and research environments and clinical training capacity for medical students, residents, and other health professionals. I want to take a moment to express how grateful we are for the community's participation in Brampton, in Peel, and beyond. This work would not be possible without those who continue to share their valuable input and partnership, whether through sustained involvement in our advisory councils or participating in School of Medicine events, forums, and other engagement opportunities. Big thank you to all once again for joining us today and for continuing sharing your thoughts and insights. We look forward to continuing this conversation in the coming weeks and months. And now I'd like to invite our Provost and Vice-President Academic, Roberta Iannacito-Provenzano, to share a few words about the mission and vision for the School of Medicine. Roberta, over to you.
Thank you so much, Mohamed, and thank you to everyone for joining us today. Our vision for a bold new model of medical training in Ontario is organized around 5 pillars, focusing on community-centric primary care and the social determinants of health, providing culturally respectful care to diverse communities, leveraging innovation and technology to improve quality of care and patient outcomes, support for the health and well-being of seniors as our population becomes older. I have parents who are 90 and 92, so I can relate. Equipping physicians with the skills to develop interprofessional healthcare networks to achieve better outcomes for patients. Our curriculum will be rooted in community-driven care and social accountability, with equity, diversity, and inclusion at the center of all our principles, practices, and teachings. The School of Medicine will emphasize an outcomes-based approach with a focus on experiential learning, interprofessional education, and clinical skills training in community and hospital settings. TMU is uniquely well-placed to build and support healthcare transformation in Ontario. Our health-related programming is already among the best in the world. We are graduating leaders every day in nursing, child and youth care, disability studies, early childhood studies, midwifery, nutrition, occupational and public health, and of course, social work. To achieve the School of Medicine's mission, the principles of anti-racism, accessibility, equity, diversity, and inclusion, and reconciliation will be embedded throughout the admissions process and throughout each of our learners' journey. The school will purposefully admit a high number of equity-deserving students interested in primary care practice, particularly in medically underserved communities. This approach will help to remove barriers faced by equity-deserving students and emphasize honoring applicants' diverse lived experiences. Purposeful admissions streams and pathways will exist for Black and Indigenous and low socioeconomic status applicants, and pathways will be explored that recognize the value and skill set of internationally trained healthcare professionals. Further, we'll offer dedicated programming and services to support students through every step of their studies to ensure that those who start their journey in medical education can complete it, regardless of the challenges they face along the way. We are committed to ensuring our graduates become compassionate, culturally respectful, and future-ready clinicians who provide outstanding person-centered care and lead health system transformation. Thank you so much for helping us shape the future School of Medicine, and we look forward to creating a healthier society together. Thank you, Usha, and I'll turn it back to you for questions.
Awesome. That's amazing. If it's not too late, you know what? I feel like I want to go back to medical school. It is an exciting future. I have to share that whenever we ask about the law school, Dr. Lachemi says it's for every person who didn't have a lawyer in their family. And that always stuck with me. And when you talk about your vision, the same thing resonates when you what you're planning for the medical school. So I'm super excited. We have over almost 100 people join us on the call. So let's get started with the conversation today. So the first question I'm going to ask you, Roberta, which is around, people might be wondering, where is the School of Medicine going to be located?
Okay, so our School of Medicine is going to be located at the current site of the Brampton Civic Center. This location, as some of you may know, sits within Brampton's Health and Life Sciences cluster and was chosen for its proximity to both the Brampton Civic and Peel Memorial Hospitals, as well as its accessibility to municipal transportation, but also the GO Transit and highway systems. And it is also in close proximity to Bramalea City Center and Jingakuzi Park, which are popular locations for gathering and celebrating within the Brampton community. The site also meets space requirements to build a School of Medicine that will require 250,000, I think, square feet for classrooms, offices, research facilities, and an integrated health clinic that Mohamed referred to before. We are incredibly grateful to our partners at the City of Brampton for choosing a location that is so easily accessible and centrally located, not only for our future students, faculty, and staff, but also, and more importantly, for our area residents, so that they can access the integrated healthcare center, the integrated health center that will be part of our new and innovative campus. TMU is proposing to establish a network of integrated health centers in the greater Brampton area as the clinical component to our School of Medicine. The IHCs, as we call them, the integrated health centers, represent a new way to train and educate Ontario's health professionals while providing direct community care and integrating research to advance population health. So TMU looks forward to sharing more information on these centers and on this model with the community in the coming weeks.
Awesome. Thank you. Thank you, Roberta, for that. And of course, I don't, with all of these requirements, finding the right location for the school, I'm sure was no small task. So I am going to ask Dr. Lachemi, how was this location selected?
Thank you, Ocean. This is an important question, an important process to understand, as I know has been some concern about the current tenants as the Romulus Civic Center. As explained by Roberta, our medical school, with all the services around it, including the integrated health clinics, is really to serve the underserved populations. Our purpose was really to do something that is with the community and to serve people who are in need of services. Otherwise, we could do this in downtown Toronto. Mm-hmm. So I think the one of the foundations of the medical school is to go to people who we know that have been under huge pressure, especially during the pandemic, and provide those services. So we're not talking here about a medical school that is isolated from its communities. It's a medical school that is well integrated with those underserved communities. And I would say that the site selection process was managed by our partners at the city of Brampton. And I want to take this opportunity to thank them and thank all the leadership at the council, mayor's office, and the rest of the community. So the city looked at a number of criteria in reviewing available properties, and ultimately the decision to offer the current site for the future School of Medicine is theirs to make. Once the site was decided upon, it was also part of the city's process to communicate the decision and timelines to current tenants. While we are pleased with the location, we do understand that some community members are disappointed by the relocation of the library, and we sympathize with residents who will be impacted by this move. As viewers and Brampton residents joining us today may know, in a motion passed at Brampton City Council last month, the city has committed to working with the library, with the Brampton Library, to funding the necessary consultant to determine the future site for the branch that is located there. They have also committed to identifying collaborative opportunities for coordinating long-term library site plans into the city's recreation and facility planning processes. I can tell you that the university is very supportive of this commitment and is confident that the city of Brampton will continue to work with the Brampton Library to find a location for the branch that will best meet the growing and evolving needs of the local community. And our role is to bring more services to people in Brampton, including educational services. And I can tell you that our medical school building will also host an important library to prepare the next generation of medical doctors, but also next generation of healthcare providers.
Awesome. Thank you. Thank you for addressing that important concern that came up in the community. In the past 3 years, I've been very ingrained in working with the community. I'm on the Brampton Board of Trade, on the Rotary Club, and we work very closely with the library as well. And so it's very important to hear you say those words. And also we look forward to how we can serve the community in our own way. And hope that the city can find an appropriate place for the library to land, which is an important service for the community. So let's move on to a different topic, which is also extremely important for the medical school. And I know this is very close to your heart, Roberta. So I'm going to ask you this question, which is, how is equity, diversity, and inclusion being prioritized in building a school of medicine?
Well, thank you for that question. And yes, Usha, you're correct. It is close to my heart, and it's an essential topic to discuss. So at TMU, we are essentially guided by our strategic vision, which is underpinned by 5 values. One of those core values is to be intentionally diverse and inclusive. In fact, we often say that EDI is part of our DNA. The School of Medicine in Brampton will be no different. Equity, diversity, and inclusion, truth and reconciliation, and social accountability anchor TMU's School of Medicine and are embedded into all aspects of our planning, including our work with our community and our medical partners. In fact, we have a specific EDI strategy and action plan for the School of Medicine. It outlines a number of goals which we are pursuing, including hiring and supporting diverse clinical faculty and staff through developing partnerships with equity-deserving physicians and health research communities, and recruiting students, as I mentioned before, equitably by developing holistic admissions criteria. We also have an EDI Community Advisory Council guiding our medical school. This council includes community members from Brampton and the surrounding areas. We're also working closely with Indigenous communities and stakeholders to develop, Indigenous health, decolonization, and reconciliation values and goals for the medical school, a strategic priorities and implementation plan, and we have established an Indigenous Communities Council. I'm proud to say that we're also actively engaged in conversations with various Indigenous representatives, faculty, and staff at TMU to see how best we can partner with them and seek regular ongoing advice and guidance on every aspect of our work at the School of Medicine. And finally, I'm so pleased to share that TMU has recently announced the appointment of 2 leads in the areas of Indigenous health and Black health. These pivotal positions will advance the school's aim to effectively serve the needs of diverse and equity-deserving communities and its commitment to an anti-racist perspective.
Amazing. That's amazing. One of the reasons I choose to continue to work at TMU is because of the strong commitment to diversity, whether it's the South Asian population, whether it's Black or Indigenous, we are always at the front of inclusion, and it makes me proud to be an employee here. We also received some questions, Dr. Lachemi, from students that are interested in the medical school. And one question was, how can current TMU students get involved? Perhaps you could answer that question for us.
Thank you very much, Usha. And I can tell you, I'm also receiving many questions from students in other medical schools saying that we are excited by the approach. How can we help? Actually, I got on social media just last night, somebody from another university saying that I'm amazed by this. How can I help? And I put the student in touch with our interim dean. And we do also have a lot of potential future students who are asking how I can get involved from now, at least to prepare myself. I still remember actually a conversation I had with the grandparents during the consultation in the Siva Food Bank. The grandparent came with his grandchild and saying that how can we start the process of enrollment. I said, well, it will take time. So actually that level of engagement is extremely high. And of course, we welcome participation and collaboration from all of our TMU community members, including students. And of course, we also have a lot of alumni and staff that are coming from Brampton and from the Peel region. And it's important for us to listen to them because their input can really help us shape the future School of Medicine. To date, TMU students have offered valuable insights by participating in various engagement opportunities, including town halls and community forums. Students have also played actually a key role as members of the School of Medicine Student Advisory Council. The Student Advisory Council provides feedback, ideas, and recommendations on program development matters for the School of Medicine. The council is composed of current TMU undergraduate and graduate students for each of our faculties, also including the school of our Chang School of Continuing Education, and also current medical students and residents from across Canada, as I mentioned. Our current council is wrapping their term, and we look forward to welcoming new members who will begin their work this upcoming fall. And we strongly encourage interested students to visit the School of Medicine's Student Advisory Council page to learn more about this great opportunity to inform key decisions across all aspects of the medical school. And I will take this opportunity also to mention for those students who may not be ready for this level of commitment, but would still like to offer their feedback during the planning process, we encourage you to keep your eye on the Get Involved page on the School of Medicine website, and we welcome your participation.
That's amazing. Yes. A lot of the information you hear today, the School of Medicine website is your spot to go to find information, perhaps as a newsletter or sign in. You could add your email to and receive this information. Whenever the next question is for Roberta, and every time we talk about the medical school and Dr. Lachemi says it's opening in 2025, I'm like, okay, there's a lot of faculty and curriculum that needs to be built. So this is a top of mind, I'm sure, for the medical school staff. So we would love to hear about how will this faculty be selected and hired. Please tell us a little bit more about that, Roberta.
Thanks, Usha. You are absolutely right. It's always at top of mind, at least for me in the provost role, but I'm sure for Mohamed and everybody who's it's been an absolute delight to work with. Everybody's working so hard to get those doors opened in 2025. With respect to clinical faculty hiring, we are actually in the process of developing a robust hiring process for clinical faculty. As you mentioned, a wide range of positions will in fact be available in line with what medical schools look like across the country. I will be working closely with our founding dean, who we hope to have in place this summer on finalizing this process. What I can share at this point is that in recruiting clinical faculty, we will be looking for faculty from the local area, individuals who live and work in this region, who have the cultural humility to deliver a high quality care, who empathize with local concerns and really understand the local healthcare system. We also recognize that the local clinical community are leading medical experts as they serve the needs of some of the most complex population in the province, evidenced by the high prevalence of some chronic conditions and high patient volumes. This is why TMU intentionally selected this region for the medical school. The local clinical faculty are population health experts, and we look forward to working with them. We'll be looking for clinical faculty who are currently working in primary care, hospitals and community care sites, and who are able to work with both our undergrad and our postgrad students. That will be important for us.
Awesome. That's exciting. I can't believe the dean is going to be here in a few months. That's very exciting, and I we look forward to getting to know him. We're still 2 years out, but I understand summer 2024 is when the applications begin. So the students, hopefully on the call of almost 100 people here, are very interested in how do they apply and what are, how many can be admitted. So Dr. Lachemi, I would love for you to comment a little bit about that.
I'm sure a lot of students are asking this question, but in terms of actually preparation, the progress has been phenomenal. What Roberta has mentioned about putting together a team, and also we obviously have now a new faculty called the School of Medicine that was approved by our Senate. And in terms of curriculum, we are taking our curriculum to Senate this month for approval. So I want also to take this opportunity to thank Roberta and all the people who have been working extremely hard to navigate this process through our internal process. To your question, pending successful accreditation, students' admissions are expected to open in the fall of 2024.
Wow.
Students will be able to apply through the Ontario Medical School Application Service, available through the Ontario University's Application Center. And beginning in 2025, we will be admitting 94 medical students at the undergraduate level and 105 residents at the postgraduate level each year. And I think you can feel it. We are extremely excited, passionate about this, and this really will be the beginning of a transformation of medical education in Brampton and beyond.
Awesome. That's very exciting. Looking at those numbers, fall 2024, my gosh, it's not very far. We're looking forward to that. Related to this admissions process, actually, some of the community members had sent in a question, and they were really wanting to understand, what is the holistic approach that we referred to in the admissions process, particularly related to admitting equity deserving students. And I'm sure you're thinking about that, Roberta, and how do we plan to do that?
So as I mentioned before, yes, we will indeed have a holistic admissions process in which the principles of anti-racism, accessibility, EDI, and reconciliation are embedded throughout.
Mm-hmm.
It will be designed to purposefully admit equity deserving students and to identify and select applicants who are interested in primary care practice, particularly in those medically underserved communities. To guide this process, we have an admissions council that's been established to determine the criteria for admission to the school, in which both qualitative and quantitative criteria are assessed. In order to address the barriers to inclusion in medical schools and diversify essentially the physician workforce, efforts to recruit equity deserving students will be direct, so through the actual design of the admission process, as well as indirect, such as efforts to increase the pool of equity deserving young people considering medical school careers. This is a longer term goal and one that will necessitate building strong and sustainable relationships with community partners, such as the local school boards, youth clubs, etc., that may exist in the area, with whom we are planning to work closely. We are also exploring, just to get into a little bit of detail, the following admissions criteria. So all students admitted to the School of Medicine must demonstrate a commitment to EDI and social accountability, and ideally primary care. All applicants have a prerequisite course or experience in EDI, Indigenous health, the social determinants of health, community health, global health, and demonstrated experience working with communities. For example, in advocacy or in volunteer roles. I know a lot of youth in the community love to volunteer. I remember I used to volunteer very often. Developing facilitated admission streams or pathways for Black and Indigenous applicants, as well as those who identify from lower socioeconomic backgrounds. We're really committed to actively recruit students from Brampton and the surrounding area, and in order to create a stream of applicants from the immediate geographical area so that local students can learn locally and ideally stay to practice locally after graduation, which is really important. We will not be requiring the MCAT as a criterion for admissions. This decision was essentially made based on evidence that demonstrated that the MCAT is a barrier to entry. This decision was published in our letter of intent, which is available on the School of Medicine website, and has been met with approval in each of our consultations. The committee is continuing to work on considering and evaluating other types of admission criteria. So multiple mini interviews or different prerequisites, or looking at cumulative GPA, and carefully considering each element from an EDI perspective, as well as the overarching holistic approach. Finally, just to wrap up this question for you, Usha, while we're focused on looking at the different criteria and how to approach admissions from an EDI perspective, we're also emphasizing the need for structures, mentorship, which is so important, and supports, right, to be put in place for a more diverse medical student body, to help set the conditions for their success, and to build a diverse, supportive community where students can thrive. So, for example, consultations with our Black and Indigenous communities have emphasized this issue. And we're partnering with groups that will work with us to ensure we build in programs, processes, initiatives from the start to ensure that our Black and Indigenous students are appropriately supported, not only admitted through their time in our programs.
Awesome. Thank you for that, Roberta. There's clearly lots of thought has gone into how do we make this medical school a unique experience for the community and the students that are going to be joining. So that's really exciting. I cannot believe that we are nearing almost our final question. The time has gone by very fast. We have one last question. We'd love to ask Dr. Lachemi to close off. You know, we've talked a lot about the vision for the school and how we select students and faculty, all exciting. But I am also sure there's lots of people in the call today who are joining from Brampton and, you know, eager to learn about how is it going to benefit Brampton as a whole? You know, how does the School of Medicine benefit Brampton in a more holistic way? So Dr. Lachemi, I'd love to hear more about that from you.
Thank you. And this is an excellent question from the community, and it's important for the community to understand the big picture. And as viewers may have read in a recent op-ed I submitted to the Brampton Guardian, the School of Medicine will bring much more to the city than just a new medical school with classrooms, labs, of course, highly qualified faculty and talented students. Here are some details. The medical school will also generate significant economic benefits. In direct spending alone, the numbers are remarkable. Annual operating expenses in the range of $100 to $150 million per year, along with $50 million per year in projected research expenditures. And non-local students and visitors are projected to spend another $100 to $160 million per year. In terms of jobs, there would be approximately 1,500 full-time equivalent faculty and staff positions, primarily located in Brampton. The creation of high qualified people, creation of high quality jobs in health sciences is expected to trigger a wider clustering, drawing additional talent and businesses to the city. At the same time, technologies such as artificial intelligence and health data analysis could offer solutions to long-standing healthcare challenges, and with it, the opportunity for the region to be a world leader in making significant contributions to healthcare innovation. We know that Brampton has been, for us, an excellent partner through initiatives such as the Cybersecure Catalyst. And Brampton is now considered as one of the most significant contributors to cybersecurity training and innovation in the country. And of course, we have the Brampton Venture Zone, and thank you, Usha, for your leadership. We are also very much looking forward to our continued work together through the School of Medicine to further strengthen opportunities and industry in the region. And I can tell you, our goal is to create healthcare innovation district in the region to attract investment from governments, but also from the private sector.
That's amazing. I'm sure I have lots of questions. The community, I'm sure, has lots of questions, but we had dedicated a certain amount of time today. And so thank you, Dr. Lachemi and Roberta, for spending time with us, answering questions. I am super excited about all these things coming to us in the next few years, especially for Brampton Venture Zone on the innovative companies that we want to engage with the medical school. And this is a great place for us to close. And a reminder for additional questions to TMU, please visit the medical school website. Please do send us additional questions. There are going to be more sessions like this. If others have missed it in your community, ask them to participate so we can share this. The more engagement we have with the community, the better our outcome will be. And we look forward to seeing you in our next engagement session, perhaps. With that, thank you very much for joining us, and we'll call it a good evening.